Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Gastrinoma, the Zollinger Ellison syndrome, and its clinical features. So the main clinical feature in this scenario is the abdominal pain. So the patient presents with the abdominal pain. So when you're looking at the gastrin hypersecretion, so in terms of the gastrin hypersecretion. So gastrin hypersecretion, it stimulates the gastric acid secretion. So this stimulates, so we're writing a star, so it stimulates the increase in the gastric acid secretion. So gastric acid secretion. Next is it leads to the peptic ulcers. So this leads to the peptic ulcers, and they occur at atypical sites. So their presence in atypical sites. So what do you mean by atypical sites? That is, it can occur in terms of the DJ, that is the duodenum, or it can occur in terms of the jejunum. Next is, they are refractory as well as it is multiple. So it is refractory as well as it can be multiple. So the other feature important is the presence of diarrhea. So diarrhea can also occur. So in diarrhea, it is acid-induced injury to the small intestinal mucosa. So it is acid-induced injury and to the small intestine mucosa. And it is the inability of the intestine tract to absorb large volumes. So inability to absorb large volumes, and this is of the fluids secreted by the stomach. So by the fluids of secreted by the stomach. Next is there is inactivation. There is inactivation. This is of the pancreatic lipase. Pancreatic lipase. So inactivation of the pancreatic lipase. This is by a low pH. Then comes the precipitation of the bile salts. So there is precipitation, and this is nothing but of the BS, that is the bile salts. So it can be due to the acid-induced injury of the small intestine mucosa, inability of the intestine tract to absorb the large volumes of fluid secreted by the stomach. Then in case of the inactivation of the pancreatic lipase, this is by a low pH as well as the precipitation of the bile salts. So another unique characteristic features of the acid-induced diarrhea. So in terms of the acid-induced diarrhea, so in terms of this is that it is controlled by the nasogastric aspiration of the gastric secretions. So it is controlled by the nasogastric. So it is controlled by the nasogastric aspiration, and this is of the gastric secretion. This is of the gastric secretion. To learn and grow daily like this, please do subscribe.